So we talked about SLD. Just do some reflection in your head. Think about, okay, we talked about how we qualify a student for SLD. How do you qualify a student for EBD? What are some things to consider? And how do we know this isn't just a temporary challenge? Because we know, especially this time, during this time, our students are going through a lot. We're all going through a lot. Our students are going through a lot of trauma. And so how do we know like the difficulty that they're going through is not a temporary thing? And then if a student qualifies for EBD, does that mean that they can they still get support with academic needs? So identification of student with EBD. So some of the exclusionary things is that it's not intolerance or insensitivity, and it's not temporary. It's not based on situational factors. So a student with having emotional behavior disorder is a serious event that can have lifelong educational impact. So what this is trying to say is we have to be careful with when I identify a student with EBD. So if it's a prolonged thing that the student needs support with over time, yes, we want to support them, but we have to be careful because the label of EBD can have a lifelong impact. Because some of the patterns and the data around students with EBD and their success, their graduation rates, their suspension rates are so much higher than every other disability area. But I think that's interesting is these students are labeled with a disability and they need the support and behavior, but they're often the ones who are most disciplined and sent out of school. So I don't have any problem with students having high expectations for students, having structure, having discipline for students. But what are we saying to these students who have disabilities and suspending them more, sending them out of school more? Are they getting the support that they need? Are they learning their social skills when they're at home on YouTube for 8 hours? No, probably not. So yeah, this is one thing that I want to mention with that. This just shows like the different terms that are used. So emotional behavior disorder there's other names for it in other states. So this is just a quick glance at that. And so basically you just know like for these labels have changed over time. Basically, that's what this is saying. And so one thing to remember is that basically that this term can be different in different states, and it's kind of transformed. So in like 1950s, it was called emotionally disturbed or socially maladjusted. And in the mid 60s, it was changed to severe learning and behavior problems. That was the actual term. But then we had to be careful. They had to change it because it was being confused with learning disabilities. So this is just some of the criteria. So if you're on a child study team, if you're a special education teacher, these are the things you'd be looking at. So the main criteria would be there'll be one of these that the student would have. So there'll be withdrawal, anxiety, depression, problems with mood, disordered processes with unusual behavior patterns, and there'll be aggression, hyperactivity, or impulsivity. So the other thing is, the other criteria of this is there needs to be an inability to demonstrate social competence at that age or grade level. And if for them to be to qualify, there has to be a significant difference between how they're performing, how they're showing up, and what's normal, quote unquote, in that age or the developmental stage of the stage. So there has to be a pattern of unsatisfactory educational progress, and it's not the result of something intellectual, like intellectual ability. It's not based on sensory ability, physical ability, health, cultural, or linguistic factors, or some kind of legal chemical abuse. It's not due to autism spectrum disorder, so that's a disqualifying factor. or inconsistent educational programming. So the last criteria that you look at is if there's an impairment in one or more of these areas. So we're looking at different areas here. So is there interpersonal impairment? So their ability to make connections or have relationships with others around them. Is it academic? Is it vocational? Is there some kind of impairment with social skills? So when we're looking at all of these areas, we're documenting all of them. We're taking data and we're looking at different assessments for all three of these. EBD is one of the most subjective labels to look at. So this is why we need to gather as much information as possible. So basically, the behavior has to severely impact their educational performance. It has to occur in 3 different settings. So if I'm doing an EBD evaluation, I'm doing an observation in 3 different settings. So I could do one in math class, I could do one during recess, and I could do one during music class. So it has to be consistent through 3 different settings. I have to show that there's that behavior that interferes with the student's progress. And then also this needs to be present, this information, this data needs to be present for at least 6 months. Does anybody have any questions so far about the criteria? So the 2 things that are brought up is a student has to be socially maladjusted. So that means that exhibits students who exhibit some kind of conduct disorder, antisocial behavior, chronic aggression, conflict with authority. So there's that, but then also they have to show that they're also have an emotional disturbance. So emotional disturbance, another way of putting that would be some kind of what is it? I forgot. Internalizing behavior or externalizing behavior. So often externalizing behavior is something that's very obvious. A student throwing a chair across the room, externalizing behavior. So something aggressive, impulsive, coercive, it could be non-compliance, but also this also includes internalizing behaviors. So I was a paraprofessional in a learning center. That's like a separate program in a school for EBD students and for students with EBD. And I noticed that there are students who had the externalizing behavior. They were throwing chairs, they were swearing, they were doing everything, like everything very, they're non-compliant and yelling and all that stuff. And then what I noticed is like there are students who were kind of under the radar who had internalizing behaviors. These are students who have their head on their desk the whole entire time during class. They are unable or unwilling to communicate with others. So very inward. So they might be withdrawn. They might look like depressed or anxious. So just remember that both that emotional disturbance could be either one of these. So I mentioned that term comorbidity before. So EBD is particularly interesting and unique. And this is, I remember I've seen this when I took this class a long time ago, they used the same graphic. And I like this because it shows like there are so many different disorders that could overlap with EBD. And that's kind of the careful thing that we need to do when we're working with students with EBD is consider that know about the student, know about what other things they might be going through or might have, because that's part of like help supporting them too, is that a student with EBD might have they may have ADHD, they might have some kind of anxiety, they might have some other disorder. So we have to consider that. And then I was just talking about this with another class, but disproportionate representation. I won't go too much into it right now, but basically nationally and in Minnesota and in the district that I work in, students who are identified with EBD are typically male. So and also Black. So students who are Black or male are 3.5 or 3.2 times more likely to be identified with EBD compared to other students. And then one thing to know is that there are students who are under-identified with EBD too. So students might nationally, we might gather data that says, okay, there are 7% of students who are SLD, sorry, that are EBD. That's not the right figure. Basically what I'm saying is that there's an underrepresentation. So there's an overrepresentation of Black students who are identified with EBD. But that means that there's other students who are different identities who are not being who are not qualified. So a few things to consider is the cultural factors that have to do with this, and really understanding. So if students are being overrepresented in different ways in these areas, it's really the teacher and the school's responsibility to investigate why this is happening and change. And so that means reducing bias, looking at our practices, challenging traditional practices, making sure we're doing non-discriminatory evaluations. The other thing that I'll mention too is with a emotional behavioral assessment, you'll have, sorry, for emotional behavioral disorder evaluation, you'll typically do a functional behavioral assessment. So FBA, for those who are in a special education program right now, you might be taking other classes like behavior intervention class. So you have to do a functional behavior assessment and a behavior intervention plan. These are used very often in schools. They're in the evaluation. I was just looking at behavior intervention plan today. So basically the FBA is like looking at a description of the behavior, prediction, like what is, so if the behavior occurs, what is going to be happening and what is the function of the behavior? Why is it happening? So it just talks about how often the situations that predict the occurrence. So in this so-and-so situation or environment, the student will show this behavior typically. And so, and then what are the consequences of that and what reinforces the behavior? And then in the FBA, it has like a hypothesis statement. So students, based on this antecedent or setting, the student will typically do this behavior. An alternate behavior would be the student will do this instead. And so this FBA will suggest different ways for the student to still receive the function of behavior, might be attention or power or something sensory, but do it in an alternative way that's maybe more safe or more appropriate. Let's see here, and then. So we talked about mnemonic devices as helping for SLD and graphic organizers. Some suggestions for EBD that you can bring into your schools to have conversations about and to think about would be, one thing to think about is coercion. So another way of saying coercion, or another term you might hear, is like power struggle. So typically when we have a student with EBD, a lot of times we get in power struggles with them. And coercion is the technical term for that. So it's this escalation of behavior that is aversive for both people and continues to go on. And it's all about a person winning or obtaining the function of the behavior. So this pattern can grow from, I just think of my daughter, my 9-year-old daughter. I've engaged with this many times, where it might start from like her like complaining or whining, like very like minimal, and I'll escalate all the way up to her yelling and going to her room, slamming a door. So kind of like goes up and up and up and up. So we have to be careful about that. And coercion, one way we can eliminate coercion and that happening is we can identify if this is a power struggle and not engage, or trade off with another staff. Those are ways you can kind of get away from the coercion. Thinking about reinforcement is another thing to consider. So providing positive reinforcement, we have to think about that sometimes the inappropriate behavior could be reinforced by positive reinforcement. So, and then also failing to provide positive reinforcement for desirable behavior could be an issue. Providing negative reinforcement behavior that allows students to avoid work. So you have to look at that, like the contingencies of reinforcement and why what the student is doing and how it's being reinforced. I talked about this a few times, the function of behavior. So what is the student maybe consciously or subconsciously looking for? So if they're not doing their work and they're leaving the room, obviously that's escape. They're using the behavior. They're not doing their work they're leaving the classroom to escape the academic work. Maybe them tapping their pencil on the table is a way for them to get attention. Or maybe they want to get into a screaming match with another peer or another adult for the sensory stimulation, for the sensory input. So I've seen that before too. So basically, we have to think about the antecedent. So what triggers the behavior, what behavior is happening, and what the consequences of reinforcement. Other strategies I'll just wrap things up. Other strategy to think about is providing specific praise. So we want to praise the desired behavior, what we want to see. You want to be specific. So like tell the students, I like that when you're sitting down quietly and calmly and listening to instruction. I appreciate you using saying thank you to me when I handed you the sheet. And being behavior specific. I really appreciate how you got the attention of the class by helping me call out students who raised their hands. So just being really specific about what kind of behavior you want them to see. The other thing is extinction. So this is like, you might hear like planned ignoral or ignoring the behavior. And so extinction is ignoring the behaviors that are occurring because their desire of the function of behavior is attention. So we don't use this all the time, but we might use this for behaviors that are somewhat acceptable, but can get worse. And this is a phenomena that happens. Is sometimes you heard this saying of it gets worse before it gets better. This happens with extinction. Is like my daughter, I was saying, my daughter is complaining, we're at Target and she's asking for a million things at Target, wants to buy a doll. And I tell her no, and she keeps on asking over and over again. And so if I ignore her and not even engage with her, she might even be louder and start screaming. So that's kind of the escalation that happens. But maybe if I just ignore the whole time, the behavior will be extinct. And maybe she will not ask as often next time. So this is an example of extinction, but that's something that that is a strategy as well. So just some things to think about. Since I'm just recording the rest of this session is think about, based on what you heard today, what kind of supports have been seen in schools for students with EBD. What kind of strategies have you seen with students with EBD? Have you seen restraints in the classroom used for or seclusion for students with EBD? Is that a practice that works? And then how do we show up as better teachers for students with EBD? So just some questions to think about, to reflect on as I wrap up the session.